Alright, so when thinking about my last standardized patient at the hospital, I watched the video and kind of went through some things that I did good and I did bad. So some of the things that I thought I did okay with was I selected appropriate tests. I took her temperature, did a urine analysis, and I had her lay down on the bed and I palpated different structures in her body. Something that goes along with the good that went bad is I didn't palpate everything, so I didn't have her flip onto her stomach, and I didn't palpate her kidneys through her backside. Instead, I just had her lay on her back and I palpated everything through her front side. So I wish I would have had her go in different positions and let me palpate that way too. I also think I did good with the history and talking to her about her social life and trying to figure out what's going on in that. I kind of started with her social life and asking her what was going on with that, and then led it into her sexual history. So I think that went actually better than I thought. It was still kind of awkward for me, but I think it went overall pretty well. And another thing that I think I didn't do as good with, or something that I could work on, is just if I had a little bit more time, I would have gave her a form that had things written down on it. I think it helps patients better when they can leave a doctor's appointment or a session with their athletic trainer or therapist when they have something on a piece of paper that explains what we did, what we want them to do, and what signs and symptoms should be, what's normal and what's not normal, things to look for. I think it helps them better when they can see it on paper, because a lot of times you're talking to them and it's in one ear and out the other. So I wish I would have been able to give her something physical for her to take home rather than me just kind of talking to her. So that is a few things about my last standardized patient.